at this number, 7 million. That's roughly how many people die from heart attacks every single year, all around the globe. It's a huge reason why cardiovascular disease is still the world's #1 killer.
Okay, so a number that huge, it's obviously a massive global issue. But to really get it, we need to zoom way, way in. Forget the global scale for a second and think about the microscopic level, right inside the arteries of the human heart. So what is actually going on in there?
So the first thing to get your head around is that a heart attack isn't just this one-time sudden thing that happens out of the blue. Nope. It's usually the final, really dramatic step in a process that might have started years or even decades before. It's like a chain reaction, and it all kicks off inside the heart's own fuel lines, the coronary artery. Now, you'll hear doctors use the technical term myocardial infarction. It sounds complicated, but it breaks down pretty simply. Myo means muscle, cardial is for the heart, and infarction, well, that just means tissue death because it's not getting enough blood. So the key takeaway here is that the heart, which is a muscle that needs oxygen constantly, is literally starving to death. So how does this starvation actually happen? Well, this lays it out perfectly. It all starts over time, as these fatty deposits, or plaques, build up on the artery walls. You can kind of think of it like rust building up inside a pipe. Then, at some point, one of these plaques can suddenly crack open. The body, sees this as an injury and does what it's supposed to do. It rushes to form a blood clot to fix it. But here's the crazy part. The fix becomes the problem. The clot can grow so big that it creates a complete traffic jam, totally blocking off the artery. And just like that, the fuel line is cut. The heart muscle is starved of oxygen, and within minutes, those cells start to die. But, this internal crisis doesn't just happen silently. The body starts sending out distress signals. The real key, though, is knowing what to look for, because the way the body sounds the alarm, it's not always what you'd think. And this is such an important point. We all have this image of the movie heart attack, right? The dramatic, crushing chest pain, the person grabbing their left arm. And yeah, that definitely happens. But that's not the whole story. For a lot of people, the signs are way more subtle. Things like feeling sick to your stomach, being short of breath, or just this overwhelming, unexplained weakness and tiredness. And this right here, this could literally save a life. These less obvious symptoms aren't just random. They're actually more common in specific groups of people. For women, for the elderly, and for people with diabetes. Why? Well, for women, it might be because the disease affects smaller blood vessels, sending different signals. For older adults and people with diabetes, long-term nerve damage can actually dull that classic chest pain, so other symptoms become the main warning. So what if there are no symptoms at all? And this is the really frightening part. Sometimes there isn't a clear warning. A heart attack can be silent. This is a huge risk, especially for people with diabetes, for that exact reason we just talked about. The condition can damage the very nerves that are supposed to carry pain signals from the heart. It's like the body's alarm system is just offline. The danger here is that serious damage can be happening, weakening the heart muscle, and nobody knows until maybe weeks or months later during a routine check. Okay, so whether the signs are loud and clear or super subtle, the second a heart attack is suspected, the clock starts ticking. Fast. We're shifting gears now from recognition to action. It is an absolute race against time to get that blood flowing back to the starving heart muscle. Honestly, if you only take one thing away from this whole explainer, let it be this. If you even think someone might be having a heart attack, you have to act quickly. Don't wait. Calling emergency medical services is the fastest, safest way to get to a hospital. Every single minute you save is heart muscle you save. It's that simple. Once in the hospital, a pretty amazing and effective process kicks into high gear. First, they'll confirm it's a heart attack with an EKG and some blood tests. Then they have to find the exact spot of the blockage. And then comes the really cool part, a procedure called an angioplasty. Doctors thread a tiny, tiny balloon all the way to the blockage and inflate it, which pushes the artery back open. And a lot of the time, they'll leave behind a little metal mesh tube, called a stent, to prop the artery open for good. And just like that, blood flow is restored. Now, if the blockages are really widespread or in a tricky spot for a stent, there's another option, bypass surgery. What surgeons do is they basically create a detour. They take a blood vessel from another part of your body and use it to reroute the blood flow around the blocked section. It's kind of like building a brand new road to get around a collapsed bridge. Look, the emergency interventions are incredible, life-saving stuff. But what's even better? Prevention. So let's talk about the final, and you could argue the most important part of this whole story.
what you can do to take control of your heart health and hopefully avoid this emergency from ever happening. And the best news is that your lifestyle choices have a huge impact. And these aren't just, vague suggestions. They are powerful preventative tools. Getting regular exercise, a mix of cardio and strength training is great. Maintaining a healthy weight, and of course, avoiding tobacco is one of the big ones. But hey, don't sleep on, getting good sleep and even enjoying a good laugh. They're all part of the picture for a healthy heart. And when we talk about diet, it's really about making smart swaps and additions. You want to focus on getting tons of fiber from vegetables, choosing leaner proteins like chicken and fish instead of red meat, and bringing in more whole grains and healthy nuts like walnuts and almonds. The real goal is to cut way back on sugar and those saturated fats, the very things that contribute to that plaque buildup we saw at the beginning. And remember, lifestyle changes work hand in hand with modern medicine. For a lot of people, especially if you're at high risk or you've already had a heart attack, medications are absolutely crucial. Things like a daily low-dose aspirin to help prevent clots, or drugs that manage high blood pressure and cholesterol, they add another powerful layer of protection to everything else you're doing. Because in the end, that's what this is all about. Every one of these steps, from what you eat, to how you move, to the treatments doctors can provide, it all serves one goal. It's about making sure your body's most important muscle keeps on beating. It's about doing what you can to keep it strong and steady for a long, long time to come.